In this episode,
one of the ways I look at it is the planet detoxes through the human species' liver.
Oh, interesting.
And I believe, pharmaceutical companies and a
That's
lot of industrial companies have figured that out. Food companies have figured that out. So that's why there's so much junk in the food, is because they know the body's going to detoxify it. The body is always doing the right thing. It just might not be doing what we want it to be doing. Oh. So in that case, those stem cells are probably going to do something, but it might be misdirected. There might be some old trauma or an old injury or a mental pathway that is causing those stem cells to go do something other than what we want it to do in the moment. They're drinking or smoking for some reason, and just telling them that it's bad for them isn't going to stop them. You got to treat the health. You got to get the health to express itself in the patient's body, to the point where one day they'll say they just don't drink anymore. Or
It is never that you see a patient whose liver is too clean that you say, why don't you start smoking and drinking?
Yeah.
Welcome back to Health in Focus with Jacobus. I am your host, Jacobus Hollowijn, a program about health, healing, and healthy lifestyles. We're not here to diagnose, treat, or cure. We're simply here to educate, inform, entertain with special guests. And my guest today is back for another interview, Dr. Sunil Bhat, who is an osteopathic physician. He practices traditional osteopathy, which we discussed in the previous interview. We'll jump on it again a little bit this time. He's board certified in osteopathic family medicine and board certified in osteopathic neuromusculoskeletal medicine. He practices in Bozeman, Montana, under the name Big Sky Osteopathy, and that's also the website, bigskyosteopathy.com. So thank you so much, Dr. Bhat, to come back.
Glad to be back.
And I thought it was very interesting to hear your personal story, how you came on this path to osteopathy. Thank you for explaining the difference between the two. And I thought we maybe can use this interview to give viewers and listeners a chance to learn more about what is it when I walk into the office of a traditional osteopath. So somebody calls you, sets up an appointment, you meet them for the first time. Let's say that's usually how it starts. Tell us a little bit how you go to work.
Absolutely. So the majority of my patients, when they come in, I say, hey, have you ever heard about osteopathy? And they say no. So I'm almost always starting from square one. Usually patients come in from a referral from a friend of theirs or a family member of theirs who I saw or another osteopath saw and they got help from. So that's usually people say, well, I'm here. This person said you can help me. I don't know what. So I always start with a brief kind of primer on osteopathy, which I'll give you now. In this country, in the United States, osteopathic physicians are fully licensed physicians. We can write prescriptions. We can do
every
surgeries.
state.
Every state.
Every state.
In other countries, in Europe specifically, and Canada, they're not medically licensed. So their license is more like a chiropractor. It's a physical doctor. But in the U.S., New Zealand, and I think there's one other country where they're actually full medical doctors as well. So. So that being said, in the U.S., like myself, we go through a full medical education, 4 years of medical school, and get a medical license, and then a residency program in whatever specialty. There's osteopaths in every specialty that there is in medicine.
That's so interesting.
From surgery to family medicine, primary care, pediatrics. So I did 3 years of family medicine residency with the Puyallup tribe in Tacoma. And then I did a fellowship year in what we call neuromusculoskeletal medicine. That's really traditional osteopathy. It's funny that we kind of make these big words to make us try to fit into the medical system, but it's...
I want to stop you. You said you worked with a tribe?
Yeah, my family medicine training was with the Puyallup tribe in Tacoma, Washington. Puyallup. Yep.
Puyallup.
They're an urban tribe in Tacoma, Washington. So my hospital medicine rotations were at Tacoma General, and then all my clinic work was with the Puyallup Native American tribal clinic. So it was a really unique experience there.
You bet.
And I got a great education delivering babies, treating newborns, treating children through adults, and then people all the way up until their 90s and 100s. And that's the beauty of osteopathy, especially with the primary care. People go into family medicine, you really see the whole gamut of health. and we can help the whole gamut of health. So, you know, we're fully licensed, which makes us a little different from the chiropractors. And Andrew Taylor Still, AT Still was our founder. He was a medical doctor in Kansas City. And he believed, he saw some shortcomings of medicine of the era, which was Civil War time. And he founded osteopathy based on 4 tenets. And that's basically the philosophy of osteopathy. The first one being the patient is a dynamic functioning whole, and it's made up of a body, mind, and spirit. So, you know, you have your physical body, which is your muscles, your bones, your organs, including your brain. You have your mind, which is how the brain interacts with the body. And then you have the spirit. The way I say it is the spirit is these extraneous phenomenon that arise when you have a mind and a body, things that you can't attribute to just the mind or the body. And
Some people may say instinct, intuition.
Yep.
That is not personally based on a mental concepts.
Yeah.
And it just comes to you.
Yep.
And, you know.
Yeah, and that instinct or intuition, we have a term called the health. And it is a primary concept in our treatments. And the health is something that is present within the body. Some people say it comes in and out of the body, through the body, it's in the environment. And it is the force of healing. It's something that helps our body heal. That's actually one of the tenets, is that the body has the ability to heal, has everything it needs to heal.
Yeah.
And it just, we can help it reach those goals. And then the third tenet would be that the anatomy and the physiology are interrelated. You change the anatomy, the physiology or the function changes.
Yeah.
You change the physiology, you change the function of the body, the anatomy can actually change.
Yeah.
Using that concept, we can physically interact with the body to affect both the anatomy and, more importantly, the physiology. And rational treatment of the patient should take into account those 3 concepts. So those are the 4 tenets.
Can I ask about that? I always understand that we have stem cells that replace cells that are done, right? They're done their job.
Sure.
They're dead. Stem cells replace it.
Sure.
So if the body is not functioning correctly, it's obstructed somehow in the energy flow. It is difficult for that stem cell to really do the best it can do. It kind of falls in that same old pattern. So by releasing the energy, if I can use that word, releasing the energy or making the flow better, it will also be easier for the stem cells to become healthy cells and stay healthy cells.
Yeah, you know.
Does that make sense? How I say that? Is that too simple?
Absolutely. I think that makes perfect sense. And what I would say is the body is always doing the right thing. It just might not be doing what we want it to be doing. So in that case, those stem cells are probably going to do something, but it might be misdirected. There might be some old trauma or an old injury or a mental pathway that is causing those stem cells to go do something other than what we want it to do in the moment. You know, most of us want these stem cells to go to contribute to our health and our longevity. But, you know, the body's doing what it needs to do. We don't always have full control over that.
No.
So that's where, with osteopathy, we're really trying to just redirect the body and say, stop focusing so much on that old trauma or that old pattern or that old, you know, mental illness, whatever. Can we reorganize the health that's within the body to move forward, to get past the past trauma,
Correct.
to help reintegrate it, get those stem cells to help regenerate, rather than have those stem cells go to make scar tissue, help the stem cells say, that scar tissue, you know, that area's fine for now. Why don't we focus on breaking down that scar tissue and actually creating new tissue itself, real tissue. So absolutely. So those are the tenets of osteopathy. And, you know, I believe that most, even MDs who have been practicing for a few decades, if you tell them those tenets, they say, oh yeah, no,
Makes
of course,
sense.
make total sense.
Yeah.
The difference is we learn those on day 1 of medical school. The first day you start medical school, they tell you about these tenets. And, you know, as a medical student, you might not be able to fully integrate it. But hearing these over and over through the first 4 years of medical school, as you start to go into the hospital, you start to go into the clinics, we start on square one with this concept of help the body heal. So, like I said, there are DOs, osteopathic physicians in every specialty. 90% of DOs go in and practice regular medicine, probably more than 90 at this point, just because that's the way the system is set up.
Yeah. It's too bad.
It's too bad, but
Because we can never, I don't think we can ever change really the medical modality the way it is right now if people are not standing their ground and say, this is really what I believe and this is what I should be doing. Because if everybody falls in the same group, then people like you totally stand out.
Yeah, there's a lot of forces in the medical education system, and it's even affecting naturopaths and chiropractors. The AMA and the pharmaceutical interests are in the education. So people get into school for a reason. They want to be a doctor, and they can be a doctor. And unless you really think outside the box or know what an osteopath is when you're going into medical school, most of the forces are going to push you down into general medicine.
Yeah.
But a small percentage of us kind of get hooked on osteopathy in medical school. We learn about these manipulations and we say, wow, these really help, these really feel good, and this is something I can do to help my patients feel better.
Right.
And then, people like myself go into traditional osteopathic practice. So traditional osteopathy, and then people say, okay, well, are you a chiropractor? And chiropractic medicine actually branched out of osteopathy. The founder of chiropractic medicine, his name was Palmer. In the early 1900s, AT Still started osteopathy 1874. He opened a school in 1894.
Yeah,
So
I think he passed away in 1917 or so.
Yeah. So in that first, I think chiropractic must have started in the first 1910 around there sometime.
Yeah.
Palmer actually took a seminar from AT Still on spinal manipulation.
Yeah.
Okay. So those what most people know of as chiropractic manipulations, we call them high velocity articulations. It's a cracking or a popping of a joint, especially in the spine. That's an osteopathic technique.
Yeah.
Palmer learned that from AT Still, and Palmer said, wow, this is the best thing since sliced bread. We need to do more of this, which is fine. And he said, we're just going to focus on spinal manipulation, high velocity spinal manipulation. We're not going to worry about medical education, being medically certified, surgery, any of the other osteopathic manipulations. And there's a whole large other area of osteopathic manipulation we'll get into. But he said, we're just going to do these spinal manipulations. We're going to start chiropractic. And he started chiropractic, and that's what they do. And they focus on finding things that they call
blockages,
subluxations, things that are out of place, that they believe as the physician is out of place and they need to put it back. Palmer learned from AT Still, and he said AT Still taught Palmer the technique of spinal manipulation, high velocity joint articulation. And Palmer said, this is all we're going to do. This is all we're going to focus on. We're not going to worry about the rest of osteopathy or the rest of medicine.
It's really about cracking let's call it readjusting the spine so that the neurological system can breathe and can have a flow.
Yeah, that's their belief, is that there's a restriction in the spine that's preventing that.
And it's understandable with all the movement and physical activity people do. Right.
Most of my patients come in after they've seen chiropractors. And most of the time, my experience is that they say, it helps for a little while, but it generally comes back. And so our belief is, rather than that spinal segment is out of place and it needs to be put back into place by a practitioner, by someone else, that pattern is being held due to something in the past of the patient. Usually it's due to trauma. It could be physical trauma, car accident, sports injury. It could be stress. Chronic stress is another trauma. It could be toxicity. It could be, it could be a whole number of different traumas. I use that term very loosely.
Sure.
But usually these subluxations or these asymmetries are organized around this past trauma. Let's say you have a car accident, you have a sports injury. The nervous system is really good at protecting, okay? So all the muscles tighten up around the spine specifically. That might cause a little bit of a torque or a twist, but the goal is to stabilize everything so that spine doesn't crack in half or get worse.
Right.
The nervous system's good at that protection. It's not so good at saying, okay, that car accident is in the past. I'm not going to have another car accident. I can relax. I can go back to neutral. Okay, so one technique of going back to center is what we call these direct techniques, where you kind of find a barrier and you force the body through it. That's a chiropractic manipulation. There's a lot of physical therapy techniques where you stretch a muscle, you have the patient push back against that stretched muscle, and then you stretch it some more. Those are all ways of moving through a barrier, which are okay. But really what we can do is we can help get the nervous system to readdress that area and say, hey, pay attention to this here. Okay, to me, this feels like it's a little bit asymmetrical. It feels like it's a little bit misaligned or really congested, suboptimal. That's the word I use. If we can get the patient to recognize this area of suboptimal, we can say, hey, can we try something else? Can we find a better position where you might be a little bit more optimal? Maybe not completely optimal, but better than where you are now. So I'll find that segment. I'll balance all the muscles around that joint, the ligaments, the tendons, the muscles, the articular surfaces. You kind of balance everything together. You check different micro motions.
Wow.
Sometimes you put a little compression in. Sometimes you put a little distraction in. You're just trying to find the right combination of force going in. And really what we're doing is we're trying to match the force that's being held in there. If it's a car accident, it was a huge amount of force in a short amount of time.
Correct.
So that can be a quick manipulation. Or you're just balancing everything and holding it maybe a little bit longer with less amount of force. And then you can find that balance point. We call balance ligamentous tension. You find that balance point
Where the body is able to let go.
and when you balance, it's a release. But really, what's happening is you're balancing all the tissues to a state where the patient's breath, can come in and start to move through that area. So the majority of the time, these dysfunctions, these restrictions, are tension of the fascia, tension of the muscles that's preventing any sort of flow. Breath is one sort of fluid flow, blood flow, lymphatics, neurologic, spinal fluid. All these fluids are different types of flow that needs to be coming into a healthy body.
You bet.
And when the nervous system tries to protect, usually some of these flows are disrupted or stagnant a little bit. So we're able to find these areas of restriction and just help the body move through them rather than forcing the body through it in the way I think needs to happen. We're just checking and trying to allow the body to move through these forces, move through these areas using its own forces.
Right.
That's what we call indirect osteopathic treatment. Rather than the force of me or the force of your conscious nervous system, we're using the inherent forces, breathing, blood flow, heart flow, spinal fluid flow. The breath of life is what we call it. The breath of life kind of expands to all physiologic functions that are happening in the body, and we're just trying to get those to be more efficient. So,
wow. So you have people come in who have been to a chiropractor before, had some success, but maybe they're stagnating. They want to try a little bit more complete approach. And then you say there are sometimes referrals from other people. Now, when from family members or friends. And then you say, there is always a little bit a doctor would like to know what the patient has gone through. Maybe you do a little intake form. You do like an intake form?
Yeah, when people schedule an appointment, they get an intake form. It usually takes only about 5 minutes. Most of it's
good.
easy stuff because,
the story is when they actually talk to you.
The story is when they sit down. And I'll briefly review the intake form sometimes, but what the intake form does is it helps people get in the state of mind of the questions I'm going to ask them.
Right.
Most of the time, they're expecting going into a doctor, and then they come and sit down and they say, this isn't like any doctor I've ever been to. And the reason is the intake form ask them questions like, physical trauma, car accidents, sports injuries, emotional trauma, grief, loss, antibiotic medications, how many times have they had antibiotics, infections. What I'm trying to do is get them in the state of mind of identifying traumas. Most people say, I've never had any trauma. My life is good. And I say, you have a car accident? Yeah, I had a couple fender benders. I walked away from them. I didn't have to go to the hospital.
Yeah.
The amount of force, even in a fender bender, the force of a car accident, I don't care how small it is, that force goes in through the car, crumples the car, light, heat, sound. But if you measure all of that, some of that force goes into the body. The soft tissues of our body are going to absorb the force. So there's a lot of things that we kind of write off and say, that's not traumatic to me. And that's a defense mechanism, and we need to do that. But if we can identify those things, rough points in life, grief or stressful times, stressful jobs, school, all these things, the body remembers. The body doesn't forget, right? So what I'm trying to do is...
The body keeps the score.
Exactly, yep. So I'm trying to get people to start to identify times or things that have come up in their life that could be manifesting, often as physical pain, but, it becomes now, it can be... These stressors can affect the nervous system, the autonomic nervous system. These can throw off hormonal balance quite a bit.
Yeah, there you go.
Headaches, all sorts of things. So we usually talk for about, 20 minutes, 30 minutes at the first visit. Just trying to get people to talk about these things and realize that it's okay. It's okay to identify things as stressful without harping on them.
Yeah.
And this allows their nervous system to reach a state of parasympathetic balance.
Oh, wow.
So, my traditional osteopathy, they call it now neuromusculoskeletal You know, osteopathic neuromusculoskeletal medicine. What does that mean? You know, basically the autonomic nervous system, that's the balance between the fight and flight and the rest and relax. That's oversimplification, but most people understand that. Sympathetic nervous system is the fight or flight. It's your adrenal glands, your epinephrine, your adrenaline. Your parasympathetic nervous system is your rest, relax, digest. It's more acetylcholine, and so it should be in a state of balance.
Right.
Most people these days, I mean, every time you get in a car, I don't care if you're driving around the block, your body knows that you're traveling in a somewhat unnatural method, and that anytime you're depending on everyone else on the road to be safe, and you know it's a sympathetic stressor.
Interesting.
We've learned to not even think about that because we drive every day, but you know we need to realize that there are many things in our life that are going to cause the sympathetic nervous system to be stimulated or revved up. Most people don't have too many practices that counteract that. So, you know, exercise, depending on the exercise, can help you relax. Meditation, you know, dancing, yoga, listening to music, being with children, you know. But you need to do it in a way that's, you could be with children and it could stress you out.
You mean little children, not big children, not teenagers.
Exactly. And working out is the same thing. You know, some people say, I work out for stress relief, but you know, if there's a lot of workouts that are going to increase your stress, and there's some workouts that are not. So it's all a balance. Getting that autonomic nervous system to be able to cope with the stresses that come in is key. And we can do that again through looking at the nerves. The sympathetic nerves come out through each rib head. So there's 12 on each side, 24 coming out of each rib head. The parasympathetic nerves, most people have heard about the vagus nerve. So comes out at the base of the cranium. And then all the parasympathetic nerves for your lower half come out at the sacrum. So people have heard about craniosacral. Craniosacral, much like I said, how chiropractic branched out of osteopathy. Craniosacral branched out of osteopathy. We call it cranial osteopathy. And all it is doing osteopathic manipulation to the cranium, which is just doing osteopathic manipulation. But in the 70s, John Upledger, who was an osteopath, learned about cranial osteopathy and said, this is amazing, which it is. And he said, more people need to be able to do this so that more people can be treated by this. So he adapted it to be able to be taught to massage therapists and non-physician practitioners. So he started craniosacral therapy. It's taught more as a technique-based thing because that's what massage therapists are used to doing, and physical therapists too. They like doing techniques. We learn it from anatomy and physiology. We learn we learn the sutures, the shape of the bones, the shape of the membranes, where everything attaches, and we can feel how things move. But that the craniosacral mechanism, or the cranial osteopathic mechanism, is what allows the brain to breathe. So every organ in our body has its own breath. Everyone knows the heart beats. That's an easy one. The lungs breathe. That's an easy one. The GI tract, we call it peristalsis. It moves food through, and so does the kidney and the ureters, moves urine through. So every organ has its own rhythm. The brain and nervous system is no different. They all interact together, and ideally, all of these rhythms are in harmony with each other. They're in resonance with each other, but oftentimes they're not. So by treating the brain, the spinal cord, the sacrum, to allow the nervous system to have a more full breath, expansion,
breathe
contraction,
all the way through,
get that spinal fluid made in the brain, circulated out through the rest of the nervous system, bring the toxins back in and circulate out. That's what's going to help that autonomic nervous system balance a little bit better. So, a lot of people come in with back pain, with headaches, neck pain, migraines, any sort of musculoskeletal symptom. We find that there's a restriction in that, it's somewhere, usually along the spine, that's preventing the spinal fluid to flow. Rather than doing a quick manipulation that might introduce more trauma, what we can do is we can find the areas in the spine or in the body that are holding on to this tension and then release them softly, which is going to really allow that spinal fluid to move, or any of the fluid, the blood flow, the lymphatics. So.
Super. So there is, you're touching on so many things, even though it seems like all you do is a little physical manipulation, but the effect of it is indeed a complete opening of what is the different autonomic and stress systems, etc. And this you may notice an improvement right away, but at the same time, it could be weeks before you really start noticing that the body is adjusting to this big let's call it a manipulation, right?
Yeah.
But let's say somebody comes to you and they have been, they realize that they want to change the way they live, they want to change the way they eat.
Sure.
And then you talk with them, and then they want to change their diet. You work with people on diet as well. You work with people on, if you notice that they have had certain habits that were not very healthy for them, you can help them to detox and help on the liver and the kidneys, etc., which are all we can separate these organs out as single organs, but you may know as an osteopathic, traditional osteopathy, that the liver is representing something, the kidneys are representing something, the heart is representing something. It's not just a single organ that has an intake and an outflow. They're connected. Can you explain to us a little bit how you translate a liver? What people say, what is a liver? You say, well, that's right over here, and this is what it does. But for you, there is probably much more to it as part of the train.
So I started, most traditional osteopaths start as musculoskeletal specialists. And a lot of people think of us as musculoskeletal specialists. So physical trauma is a big thing. Car accidents, sports injuries, slips and falls on ice up here.
Sure.
Those are big. You treat that, that's easy to identify, easy to treat, and people are still having problems, especially when it's digestive issues. And then you realize, okay, well, trauma, again, it's a loose word. Toxicity is really just one more sort of trauma. And toxicity is something that's more of a chronic trauma.
Okay.
Our body is really good at dealing with acute trauma. Acute stressors, acute insults, the body's pretty good at it. And actually, a lot of wellness therapies that are coming out now use that concept. They introduce a small, controlled dose of stress. Sauna is an example, a cold plunge is an example, high-intensity interval training is an example. You're stressing the body with a little stress or a big stress, but a dose, a controlled dose, and then you're allowing your body to recoup, to recover. And that recovery phase is what improves the resilience. So acute stressors, the body can deal with them. Chronic stress, on the other hand, that's the bad news. And if it's chronic physical stress from repetitive strain from working a desk job, that is so much harder to treat than a car accident.
Interesting.
So toxicity is kind of the same way. Our livers are probably the best detoxers in the whole planet. The planet, one of the ways I look at it is the planet detoxes through the human species' liver.
Oh, interesting.
And I believe, pharmaceutical companies and a
That's
lot of industrial companies have figured that out. Food companies have figured that out. So that's why there's so much junk in the food, is because they know the body's going to detoxify it.
Yeah, they can get away with it.
We can eat, you can eat one meal at McDonald's, you'll feel like crap for a day or two, and then you'll be fine. But if you're eating McDonald's every day, you're going to get sick. You're going to get chronic illness. So,
however it expresses itself.
So toxicity, it comes in through our food, it comes in through our water, it comes in through the air. We're constantly bombarded.
Medication too. Let's be honest. Yeah. I mean, I'm not putting down medication. There's a place for it, but people take so many medications, and you simply look up in the literature what the side effects are of certain medication, and I often talk to people about what they're on, and I said, let me just show you what side effects are, and they said, well, ever since I've been taking that, I do have those 5 different symptoms, and they don't think about it twice, because they go back to the doctor, said, now I have this, they get more medication. And so why is that? Because the liver needs to process everything.
Most people know that medications are hard on the liver. Everyone knows Tylenol is hard on the liver.
But short term is one thing, but not, you're on it for 25 years.
Exactly, every day. So it's identifying these chronic toxicities and how our body is trying to deal with them. Okay, so we have a few different ways to detoxify. And what I mean by detoxify in this case is gets the bad stuff out. So you have your gut. You have your breath. You have your skin. Those are pretty much the three, the three major ways we can detoxify. The gut does your body wants the gut to do the majority of that. Your urine is also in there too, but if your gut is working well, the sweat, the breathing, the urine, the urine's going to work, but the sweat and the breathing is not as big of a problem. If your gut's not working well to detoxify, then all those other things are trying to keep up, and that's when people really start to have problems.
I see.
So the liver is the main detoxifier of the whole GI system. We need to make, people come in who are constipated, we need to make sure that things are starting to move. That's the most important thing. Once things are moving out through the GI tract, then you need to make the detoxification pathways in the liver more functional.
Okay.
The most interesting thing about liver detoxification that people don't really comprehend or think about is globally the bile, how the bile works, okay? The bile is a fatty liquid that helps us digest fat in our food.
Okay.
It's made by the liver, stored in the gallbladder. It gets secreted every time you eat a meal, helps digest the fat in your meal, and then gets reabsorbed into your bloodstream, makes its way back to the liver, and then back to the gallbladder. And it sits in the gallbladder until you eat your next meal.
Correct.
If you don't have a gallbladder, if you've had it taken out, it's that same loop minus the gallbladder. So your liver is just making more bile each time. But that works great if what you're eating is good food, okay? Now the problem is fat-soluble toxins. Okay, so any molecule that we have in this body, it's either fat-soluble or water-soluble. It's polar or non-polar. Water-soluble toxins you're going to pee them out. And they're going to dissolve in the blood, they're going to make their way to the urine, you're going to pee them out. It's not that big of a deal.
Yeah.
The fat-soluble toxins, on the other hand, these are the toxins that stick around. They come from our food, the fat in our food. So if you're eating animals that have toxins that are going to be in the fat, and you eat the fat, it's going to be in you. So fat-soluble toxins are the thing that causes the problem. And in the bile, you eat the food. Let's say you eat a hamburger at McDonald's, and that has some adulterated fat in it from the cow. You eat it, sits in, and then the bile comes in, digests it. Now that fat-soluble toxin is in the bile. And we have this closed-loop system where the bile gets reabsorbed, and it just stays there. So people come in and they say, every time I eat, I feel like crap. And they're trying to figure out if it's something they eat, but no matter what they eat, they're having some of these symptoms.
Right.
It's actually the toxins in the bile.
I see.
Mold toxins, those end up in the bile. So a lot of fat-soluble toxins come from other biological agents, come from infections. So if people aren't doing something to help clear the bile, make new bile, these toxins just build up. And in someone like you and me who don't have a lot of body fat, that bile is probably...
Oh, I got plenty.
But that bile is probably the largest reservoir of fat in the body. So those toxins stay there. If you have a lot of adipose tissue, those toxins are going to go there. And
I do want to ask something real quick. When we eat and the food is leaving the stomach and goes into the duodenum or duodenum, you get the pancreatic enzymes as well, and there's lipase in there, which is supposed to break down fat.
Right.
Is it just that we don't make enough lipase, or is the lipase only addressing a certain type of fat and we need the bile for the other fat?
So the lipase is going to break down the fat into smaller lipid molecules.
Right.
What we're concerned about is toxins in the mix. Okay, so you have your fat of what you ate, and then you have extra toxins, chemicals, pesticides, hormone mimickers, plastics, all this stuff. These are small toxic molecules. They're not inorganic, and they're sitting in these fat globules. So you can break down the fat globule as much as you want, but that toxin's still going to be there. So the lipase isn't going to break down the toxin. The lipase is just breaking down the fat. And then these toxins are going to stay there, and they're going to end up either in your bloodstream, or they're going to stay in the bile and end up back in your gallbladder.
Yeah. So there are people who have gallbladder issues who actually have a very healthy diet. And that shows me that since we're all individuals, there is a reason why that happens. There are people who really don't have a healthy diet and they don't have any gallbladder problems. So it makes it frustrating, but somebody like you, how can you tell? Is there something where you feel the body? Because I know you feel the arms and you feel the ligaments and you can feel the energy flow in the body. That you feel there is an issue with the gallbladder, right? Like an acupuncturist often feels the pulse and can feel all these parts of the body, how it flows and how the energy is. then you look at the person and say, well, you must be doing something wrong because you have all these gallstones or you have this. And they go like, I don't even eat.
Yeah.
I eat healthy fats. I eat organic meats or grass-fed beef or something like that. They don't understand why they have these issues. Can you give us an example that you have witnessed where you say, yeah, it happens?
So sometimes it's not something they're doing wrong, but something that's happened to them in the past that is preventing them from working properly. So yes, they've cleaned up their diet now, but some trauma from the past is preventing that gallbladder, the nerves really, the autonomic nervous system, from properly regulating the whole digestive system. In addition to some toxic buildup, again, in the bile. This toxic buildup, if someone hasn't cleared their bile, done a liver cleanse or a bile cleanse, if they've never done it, which most of my patients have never done it, these could be toxins from childhood.
Yeah.
Who knows? It's bile sludge and gallstones. To me, that is always toxic buildup in the bile until proven otherwise. And if you can clear that out, the first thing, the easiest thing for most people is clear that out. Take something that's going to help express the bile along with something that's going to help bind toxins in the bile so that you expel it, make new bile. And then with the physical approach of osteopathy, identify areas in the nervous system that are restricted that's going to prevent that autonomic nervous system from properly affecting the digestion. Because we want a full parasympathetic function for digestion. If someone's autonomic nervous system, a sympathetic nervous system, is constantly revved up, stress at work, stress of the family, they can never turn off the stress, their parasympathetic nervous system isn't going to come up enough to help the liver make that bile, help the gallbladder express that bile, help the intestines work with that bile, do the digestion, get the bad stuff out, keep the good stuff. All that stuff is going to be, trying to work in the background when they're worried about their stress.
Yeah.
So, and it might not be stress. It might be a physical injury. It might be an old car accident that caused whiplash. Their head isn't stable on their body because these neck muscles are always tight, and that's causing their sympathetic nervous system to always.
So then when, let's say, stick with the liver for now, then you notice the individual, you do an intake, you talk with them, you get an idea, traumas, grief, sadness, diets a little bit, where did you go off the rails, so to say, what happened in your life, and you start understanding all that, and now you say I notice when I work with your body that your liver is indeed asking, for help to work through it. Then what are some of the options a person has? Do you again focus on the individual and say, they're not going to be able to handle this, or I can start with this? You work in steps?
Oh, yeah. So
or is it something that is pretty straightforward?
The beauty of what I've found with osteopathy that's beautiful is that when they're treated, when their nervous system is treated properly. So usually patient comes in, I'll see them for an hour and a half, doing 30 minutes of talking, an hour of treatment, and that treatment is with my hands, and get their whole body. I start at the feet, work to their head. My main goal is to get that cranial mechanism, that brain, spinal cord breathing well, perfusing the whole body with that rhythmic impulse. I'll bring them back usually about 2 weeks later, and then after that, once a month. That's it. So people are used to seeing the chiropractor 3 times a week, something like that, and they say, it's not working.
That's how they start, and then they go once a month, once a year.
But the thing is with osteopathy is because we're working in that parasympathetic system, the patient's body is doing the work, and it's really receiving what we're doing without having to keep coming back. So as you're treating them and allowing that nervous system, that autonomic nervous system to balance, I don't need to say, hey, you need to stop smoking. You need to stop drinking. You tell them, alcohol is probably not good for you, but they're going to, we have to have faith that the health, they're drinking or smoking for some reason. And just telling them that it's bad for them isn't going to stop them. You got to treat the health. You got to get the health to express itself in the patient's body to the point where one day they'll say they just don't drink anymore.
It is never that you see a patient whose liver is too clean that you say, when did you start smoking and drinking? Doesn't happen too often.
So, those first 2 or 3 treatments, usually 3 treatments over the course of a couple months, we get their nervous system to a state where it feels like it's functioning better.
I see.
After that,
Because the body knows what to do with
The
it.
body
Like you
knows what to
said, the
do.
body can heal itself, wants to heal itself. So to open up the channels, the body starts to function normally, and there is a natural realignment happening, if I can say it that
most of
way.
it's happening subconsciously. I mean, yeah, you can a lot
Yeah,
of this
yeah,
can be
yeah.
aware. They can be aware of it. We can be talking about it. We can be dissecting it. But most of what's happening with the health is happening in the background. So we treat them a few times, get their nervous system functioning well, and they come back and say, yeah, my digestion's better, but I still have this pain when I eat fatty meals or whatever here, or I'm still not having enough my bowel movements aren't great, whatever.
Yeah.
So then, I'll come in and I'll say, okay, yeah, there's more congestion on the liver. You can feel, just like you feel a muscle, just like you feel a bone, there's a fluid quality and a solid quality.
Okay.
And the body likes to be fluid, doesn't like to be congested. And so we can feel congestion in different organs. We can feel congestion in different areas of the body. So the liver will have a little bit of hardness, congestion, and it's not breathing. It's not having it. When you take a breath in, the liver is right underneath that right lung. There's a diaphragm, lungs on top of it, liver's underneath it. So when the lung breathes in and pushes down, we want to feel that liver pushing down without any resistance.
Oh, wow.
Oftentimes we don't. Oftentimes there is resistance there from congestion in the liver.
Yeah.
And I'll say, hey, your liver feels like it's not breathing as well as it could be. And sometimes that's all I say, and that's it, and we leave it at that. Or sometimes say, oh yeah, a patient says, I've been wondering about my liver, and someone's been talking about liver cleanses and blah 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 blah. And so then I talk about the bile, and I talk about what we just said about this whole closed loop system, and we say, okay, well, I personally do twice a year. I'll do a liver cleanse, get the bile cleared out. I use a bile acid. Some people use ox bile. I use a purified bile acid. I use a binder. You can use various different types of binders, and then some herbs to help the kidney and the liver. Basically,
And that's a cleanse that is 2 weeks or
I do it for a month usually.
A month, okay.
Just because it's that way you don't end up with leftover supplements. Just finish the bottle, be done.
Oh,
with it, don't
that
think
way.
about it.
Yeah.
But you could, if you want to do it for 2 months or 2 weeks, that's fine. I have a lot of patients who do it for a month and they say, wow, I feel great. My energy's good. I'm sleeping better. I'm eliminating better.
Yeah.
Can I keep doing it? I say, yeah, that's fine. This is safe. This isn't something so hardcore and intense. That's the problem these days with these cleanses. People are doing these cleanses. They're so uncomfortable, and people feel like it needs to be uncomfortable for it to work. But then they never want to do it again. Oh, I did a parasite cleanse. I was, in the bathroom 3 times a day for a week.
Yeah.
The problem is parasites keep coming back.
Yeah.
So if you do something like that and you've had, went through hell with this protocol, you're not going to want to do it again.
Yeah.
So I've tried to find treatments and protocols that are comfortable and effective that people can do ever so often that they want to. So, twice a year is a good starting point. At the beginning, some people want to do it for a few months just because they feel better with it. And then eventually you just do it when you need
Is that
to.
also a reason why people like to start in the spring, because they've come out of the winter, they've had all the holiday celebrations and the food, etc.,
Yeah.
that there's this thing about spring cleaning, and no, it's true.
It's true. I mean, I do my cleanses. I do a spring and a fall. I just think with the calendar, that might be part of the reason. I think with the sun coming out, the days getting warmer, the plants growing.
Yeah, around the equinox.
It seems like a nice time to do it, but it is what it is. And I tell patients the main goal with osteopathy is get you back in tune with your intuition. I don't want you coming in to listen to what I have to tell you and waiting for me to tell you to do something.
Right.
The goal is that after a few treatments, or maybe a few years of treatments, you're able to listen to yourself, and that little voice in the back of your head says, I need more vitamin D, or I've been taking a lot of vitamin D, I can take a break for a little bit, or maybe my gut's a little not feeling right, maybe I need a liver cleanse, or maybe there's some parasites going on here. And when you hear that voice, you come in and you talk to me, and we'll say, okay, well, how does it feel? What do we need to do? But the patient's innate health, their intuition, their intuitive health, that's what should be driving the game. And by getting that autonomic nervous system balanced better, they're able to feel it.
Yeah.
So
I sometimes think that we should integrate the body, the understanding the body, into our education system. No, seriously. I think when children go to school, they should start to understand simple things, how the body functions, and then even tell them, there are certain things you can do to help your body feel better. And of course, young people usually have no problems whatsoever. They can do anything they want.
Yeah.
And but to integrate, to educate people more about how the body functions and what are some of the things that can that can have a certain effect on your stress level, your liver function, your overall body function. Sometimes the physical risks that people take, like you with your rock climbing you were talking about, and the rollerblading and all that stuff. Well, not skateboarding, yeah. But to be on 8 wheels or 4 wheels and doing weird things, that could be dangerous, right? And it could have a lasting effect on you. So I'm not saying people cannot take risks and walk on the straight and narrow, but I think if young people already have a better idea about what how the body functions and what the mind is and the spirit, then I think that it would really be helping them in the long run, because now they live their life and then there is a problem and then they decide to come to a physician to get educated. Right? And no, it's true. Don't you think so? I mean, it is great. It's great for work, but it's not what I mean. It's not about taking work away from you, but I think that we could make our society function better and healthier if people want to go to McDonald's now and then, if that's what they want to do, go for it. I mean, when you start explaining to them how the fries are made and what kind of meat they use, etc., they go like, I'm never going there again. But it is not about fanaticism. It's simply a question of education, that you understand that your body is not the body is not just the simple parts that we talk about, a liver and a leg and sexual organs and hormones in the brain, etc. It works together, and the way you're explaining it is really, I try to help the body open up the flow again, so that every aspect of our body gets oxygen and gets nutrition. And so once we understand how that works, then you start to become more responsible about what you put in your mouth.
Sure.
And how the digestive tract works. And I often talk to people about digestive issues, and I say, physicians have told me that the whole digestive tract from the mouth to the anus is official. That whole system is actually outside the body.
Absolutely.
Because there is no blood. Yeah. If you bleed in your stomach, don't come see me. You know, if you're bleeding out of your rectum, don't see me. Don't go see somebody else. But there is a way that we need to respect the digestive system. I see part one of your immune system is what do you put in your mouth. You know, that's the choice you make. Sure. Number two, your digestive tract is letting you know that you did something wrong. Sure. And by giving you symptoms like bloating and acid reflux and GERD and diarrhea and colitis and stuff, these are all symptoms of something that where your second part of your immune system is telling you, hello, you know, we're not going to let this food go into the bloodstream to nourish you, because it doesn't, it won't. And so sadly, people want to put the Band-Aid on and take medication for their digestive issues, where they could really learn how to nourish the body.
Yeah, you know, so I mentioned the autonomic nervous system.
Yeah.
And, you know, we put so much focus on that as osteopaths. I call it, you know, in some ways it's the unconscious nervous system. So you have your somatic nervous system. You think you want to move your hand, you move your hand. That's somatic. It's conscious.
Yeah, sure.
Autonomic nervous system is moving in the background. You don't think about it. You can control your breath. You can control your heart rate if you're really good, but you don't have to think about it. So the beauty of focusing on that autonomic nervous system is that these things, you know, consciously deciding what you're going to eat and what you're not going to eat is good, but it's very difficult for a lot of people. If you are reconnected with the health, which is underlying, it's this almost more intuitive concept, it's unconscious, you're not going to even want to go to McDonald's. Okay, maybe you're with a group of people, you go to McDonald's once a year, and you'll be fine.
Sure.
But when we're so, you know, the thing with humans, this human species, we're so in our head and we have so much control over what we can do consciously that we forget that what you were saying, we wish we taught kids at a young age about their bodies. We know that information is there. We all have that information. Yeah. We have that connection to, but we're so dissociated from it because of various things, culture and society is a lot of it. But that innate intuitive information of how our body works, is it right? Is it wrong? Is it right for us now in this moment? That's all there, but we're just disconnected from it.
Yeah.
So by physically, my hands connecting a patient's body to their own nervous system. I put my hands on a shoulder and I compress and I show this patient's body that, hey, this area is congested here. There's a little bit of tension here. The patient, when there's something that's chronically tight, we forget about it so that we can keep going forward. If I put my hands on and say, hey, there's something going on here, the patient's body says, oh yeah, I'll take care of that, no problem.
I see.
So it's a practice, as I treat patients, it's a practice of allowing their nervous system to tune back into itself, their own body. Eventually they don't need me anymore. Same thing, and this is, that's the musculoskeletal example, but this can happen with the digestive system, the immune system, everything, the neurologic system, everything. It's just the body being able to pay attention to itself and remember the knowledge that it already knows. And, when you're talking about the kids learning, it made me think about the original use of yoga. Yoga was developed for young boys.
Oh.
In India, they do these young kids in the boys' schools, they'll do yoga for a few hours, get their body moving, and then they can sit and learn. Sit quietly and learn. But really, it's a process of that. Yoga is, again, to me, it's kind of the same as osteopathy. It's something you can do for yourself. It's allowing your nervous system to sense every part in your body, passively or actively. With osteopathy, it's more passive. With yoga, it's more active.
Yeah.
But it's allowing that sensory system to turn internal. Our five senses are almost always going out, but we can turn them in, and that's what osteopathy really
What are
helps.
the five senses? What are the five,
Well, your vision, that's
Vision.
almost always going out. Your
Ears.
nose, mouth, and then your touch.
Your touch, okay.
So the touch, that tactile sense, that's the one that can go back in. We can feel what's going on inside our body if we practice.
Yeah.
If you don't practice, you don't. It's just like playing an instrument.
Yeah,
The
you're
amazing
right.
thing, you watch someone who's been playing piano for 10 years and see how their fingers move, or saxophone.
Yeah.
It takes practice.
Absolutely.
So the same way I can feel into a patient's body, it takes 10 years of practice. But the patient, you can do that yourself. You can feel you can feel your organs, you can feel how things are moving, where areas are tight, where areas are feeling good. And then you just allow that health to move to that area.
Yeah. I think for some people, doing exercises is maybe, or yoga also, maybe two of the ways that they can get in touch with their body. Right? They realize the flexibility, they realize how far they can go, how much they can lift, how high they can climb. Otherwise, if you don't do those two, for example, it's very hard to even think about your body function unless you have a symptom such as diarrhea, stomach aches, headaches, of that nature. And then we feel we're so busy we have no time to pay attention to it, so you start taking some type of medication, or people come to buy supplements and hope to solve that problem. And it's obviously it's a very complex issue, but it's so interesting, the whole field of osteopathy, that as you say, you've practiced to feel the body and understand the flow and the blockages, and then start educating patients and then help them by some body manipulation to start to flow up, and then by some repeated visits, not only to make the patient more aware, so that they can do the little things every day to become more in tune with what they're doing, and meanwhile just improve the quality of their life, and that means the mind and the body and the spirit, which is super interesting.
I mean, it's a physical education. The same way you're educating your viewers here, the osteopathy is physically educating the patient's body.
I see.
Getting their nervous system to interface with the rest of the body more efficiently, physically. They don't even have to do it consciously. So that's really what osteopathy is. It's just teaching the patient's body how to work better in the moment.
Well, thank you. Thank you for explaining that. I have a feeling we're going to talk more in the future, because there is so many, when you look at pathology and different diseases as they're being described and try to be made understood for doctors and doctors for patients, your approach to hormonal health, for example, your explanation and working with people with digestive issues, mental health issues, depression, traumas, all that stuff, I would like to pick your brain more on how you work with that with patients, and because the practicality of it is what people like to hear. it's not just what you know in a book. It is really, this is what I do. And here are patients who come to me with these issues. How do I address that? And so that they become more aware of it. So I do hope you come back.
Absolutely.
And then we can make it more of a series.
Cool.
You know, and then we have all this collected, and I think the viewer is going to be the winner because they say, wow, I didn't know there was so much to my body that I never pay attention to.
Yeah, and I'll put a plug, to find, it's not easy to find an osteopath, unfortunately. There's an organization called the Osteopathic Cranial Academy.
Osteopathic Cranial Academy. Okay.
They have a physician finder. They are just traditional osteopaths. So if you're looking for a traditional osteopath, that's where I always send patients who are looking for an osteopath for a friend who lives in Florida or whatever.
And I think there's 2 schools of traditional osteopathy in this country. Is that right?
Well, no, there's a lot of schools of osteopathic medicine, but there's no just traditional osteopathy school. It's all osteopathic school. So you have to go to osteopathic school, and then either you practice conventional medicine or you practice traditional osteopathy.
I see.
So yeah.
And there's quite a few of them in the country.
Probably approaching 100 now, maybe.
No way.
More. Yeah, they're opening up a lot. Recently, there have been a lot of openings.
Oh, that's hopeful.
There's 2 that just opened in Montana. There's one in Billings and one in Great Falls.
So.
Yeah.
Wow.
The question is how many traditional osteopaths are going to come out of each class?
Well, but it's there.
Yeah, it's there.
It gives people the opportunity.
Yep.
Well, thanks for being here today.
Thanks for having me.
Thank you all. Thank you all for viewing. I hope you learned something today and that you tune in for another episode of Health in Focus with Jacobus. And we definitely will have Dr. Bhat back on this program to learn more about different other approaches that we can do for our body to become the best we can be. So thanks for viewing today and hope to see you next time. Bye-bye.